So, hello everyone. How are you guys doing? Yes, it's me again, Decency NCLEX, the vendor of good news, coming to you today live from Virginia, United States of America. And today we have a very interesting personality in our midst. Okay, you guys should just wait before I start an introduction. I ask people to let us know where they are joining us from. So I will just go over to the comment section and read. Yeah, we have Tolulope Ajayi, yes, from Green Bay. Tolu, you're welcome. We have Colette from Canada, Ontario. Yes, you're welcome to this show, guys. And we have Akande from Oyo State, Nigeria. Abigail from Enugu. Thank you for joining. All right, we have someone else from Wakefield, West Yorkshire in England. You are welcome as well. All right, we have Esther, we have Maureen, we have Victoria, all from Nigeria. You are all welcome. All right, let me see if we have more people. I can see a lot of people in the waiting room. So we have Precious from Nigeria, and we have Mimi from South Africa. So you guys are welcome to today's show. Please, we have people from different countries. I would like to see your friends on this show, guys. Please, can you let your friends let them know that we have started the meeting so that they can join us as well. Okay. Thank you all for joining. Thank you so much. So without further ado, I would like to start the meeting. All right. So today we have a beautiful lady, a beautiful soul with us today. Her name is Decency NCLEX, happened to be my beloved wife. Okay. So, but aside from that, we're not going to be emotional today. We're going to be very, very straightforward. We're going to be straightforward and on point. Please, as we are going through the interview, I would like you to save your questions. If you have any question about relocating to the United States, any question about all the things that you might need, things that should help you in your relocation process, this is a go-to person. This is a one-stop shop for you to get that from. Okay, so I believe she'll be able to help you guys with all the questions that you might have today. Choma from Nigeria, thank you, and you're welcome. All right, so she is, she has a lot of spheres of leadership that she has been through here in the United States. She's been a nurse manager, she's been a manager, a consultant, then a manager and almost a director at a company here in the United States. And she has also been that's nurse manager. Do I have to mention the hospitals that you've been a nurse manager in?
No.
Specialty sake, okay?
No.
So I would save you guys the stress of all those names, but she's been a nurse manager, she's been almost a director at a company in the United States, and she's been in different spheres of leadership. Even in the DNA, she's also wearing the cap of the director of finances. Okay, so she's been a great support to the great growth of DNA as a company and DSS as a company as well. All right, so she's a registered nurse. She has a master's degree. She's pursuing a doctorate degree as well as it stands now. Okay, so I told you guys before, I'm done with studies. Okay, but she's pushing me. She's asking me, oh, you have to go forward. You have to go forward. But that's fine. We're going to leave that for another day. But today, we're going to be talking about what really helped her. So, Stephanie, you're welcome to today's program. Say hi to my friends.
Hello, everyone. Good evening. It's good to be here today. Mr. Decency, thank you very much. You've said it all. You were just blowing my mind with that introduction, but that's fine. Hey, guys. Good to be in your midst tonight. Wherever you are watching us from, we appreciate you being here today. Thank you so much for joining us. And be willing and open-minded to also learn. Keep your questions. At the end of the program, you can ask any questions that you need to ask, and I will be willing to answer to the best of my knowledge. Thank you all once again, and welcome.
All right, so guys, one thing that is, thank you for that welcome that you gave to us. And one thing that is common with everybody here is that we are all nurses from Africa, and in different times, we've either immigrated to different country or we are planning to migrate. So I know you have gone through this process, and I would like to know what inspired you, to really migrate from Nigeria to the United States of America.
Thank you, Mr. Decency, for that question. So my decision was inspired by the desire for professional growth. I am Oliver Twist. I want to know more. Yeah, I want to know more. And also I wanted to gain knowledge about advanced technologies. Let me say I've worked in best hospitals in Abuja. I wouldn't be wrong if I say that. I've worked in several hospitals that are really, really good, so I've seen it all. I needed to know more. So that's one of the things inspired me to pursue this career. We have seen, like, I'm an OR nurse, so I'll be making reference to the operating room because that's where I worked, so I've seen many surgeries we've done. I've seen the laparoscopic side of it, but I heard about a robotic surgery. I've never seen that done anywhere. As at the time I was in Nigeria, if they're doing it now, it's a plus. But as at the time I was still in Nigeria, I've not seen any hospital that does robotic surgery. So, and I've read and I know that they do it in America. I'm like, okay, this is a good place for me to gain this knowledge. It's one of the things that really inspired me. Also, expanding my knowledge, expanding my skills, safer practice. In America, I will be honest with you, you have a safer working condition and working environment compared to some or most African countries. So I needed to experience that. I've had friends that are in America that have told me, hey, you can't even compare. Oh, America is this. Nurses have autonomy. Nurses can do this even without the doctor telling them to do it. You can do it and then call the doctor to get an order. A patient can be in crisis right now. Of course, you can't start looking for the doctor. Every single time matters a lot. So you don't even waste time. So do the actions. They have policies, they have procedures, they have policies and procedures that guide each hospital. So this is one thing you're to go that you have to be with every time. I mean, it's in the computer. Log in and read about the policies and procedures. Know your limits. Know what you can do. That is one of what is going to help you. So in America, they don't waste time. I've heard about all those things and I'm like, okay, I would really like to experience this. And yes, I have experienced it. And I'm really, really happy that I have experienced it, and I did, and I'm still experiencing it. For instance, like I was using a patient that's in crisis, just check, oh, this patient is in crisis. Do I have to wait for this doctor? No, go ahead and do what you have to do at that time. When the patient is stable enough, go ahead and call the doctor. Hey, this patient was in so crisis and I did this and I did this. The doctor will say, okay, write down the order for me. The order you would have called him long time ago to get. You don't know where he was at that time. Probably he was, somewhere with family. He wasn't even with his phone and patient is dying and you're waiting for a doctor to get an order for something you can do. So do it, and whenever the doctor comes in or even at home, he can log in and approve that order. So those are the things that I really looked forward to, and they are part of the things that inspired me to pursue career as a nurse in America. Thank you very much, Mr. Decency.
Thank you so much. And I see some people are having troubles with their audio sound. So let me just check. This is a mic check. I should have done that before. Please kindly check on your sound. If you can hear me, please just go to the comment section and say I can hear, so that I know that it's not just me. Please kindly go to the comment section and let me know if you can hear me. So yeah. So Nkechinyere, I think you should try to play around with your mic. Try to play around with it. Maybe there's some buttons that you need to press to make you hear clearly. Thank you so much for all the people that has commented. Thank you so much. So now you've said it all. You went deep into that. You gave us instances, and I know you are an operating room nurse, and I know that this is more than a profession for you, because I know you. I know how you've actually carried your operating room duties. Okay, so you're one with a difference. But I want you to give us a rundown from clock in to clock out. What is your daily schedule like? I don't know if there's any operating room nurse right here that is listening to us. Do we have any person who works in the OR in the audience? Do you have anybody that works in the OR? If you work in the OR, say I work in the OR in the audience, or if you don't, that's fine. But she's going to give us a little breakdown of what a day-to-day activities of her day is. Like when she gets to work, you clock in, or what are all the activities that take place until you clock out? Can you run that for us? Run through, take your time. We have all the time. Don't try to rush. Just take your time and go through all of the things that you do in your day-to-day activities in the US, because that's the clinical adaptation we are talking about. We're going to come back to, asking more personal questions, but I want to be able to let the audience understand you, then we can move from there. Is my question clear enough?
Yes, sir. Thank you very much. I mean, operating room is just my home. I mean, right from nursing school, most of my posting was in the OR. I grew passion. I developed passion. Well, if you don't have a passion for anything, you won't go far in that thing. Let me just put it that way. I was so passionate about operating room that even as a student, then they can leave OR for me to manage. Maybe they have somewhere they are going, they are short-staffed, they will call me, hey, Oyinye, come and take over this OR for us. It happened. And I'm happy that I did. I remember I'm just giving you a background why I'm so passionate about OR. I remember one of the nurses in the OR where I trained had an interview somewhere in Abuja. He couldn't get anybody to cover him. They had to pull me from the school. I'm saying this here. I know, I know someone is here that is like, oh, you were doing this. So yeah, they had to pull me, take permission, and they pull me, and I'll come and cover the OR for them. So when I came to America, oh yes, I've received some recognitions as well as an OR nurse. OR is very sweet. It's a very interesting area. It's like a family, coming together to work. So my daily activities in the OR, once I come in, clocking is not like in Nigeria, in most African countries, do we clock in? No. We have a place to
if you
write
don't
our
clock in
name.
here, you don't get your money, you don't get paid. So
Exactly.
clock in, you get your money.
If you don't clock in, it's as good as you didn't come to work. Unless you have to go back to your manager and tell her, hey, I missed my clock in. And if you can do it on your own from the computer, that requires them going to verify. So instead of doing all those things, just save yourself the stress. Go ahead and clock in. And this is my daily routine every day in the OR. Once I clock in, the next thing is I go in, pick my scrub. We have a scrub dispenser. It's not like in most African countries, in quotes, where they keep scrub. In fact, most times they're even looking for scrub to wear, but this one, you have scrubs in the machine. We call it the scrub dispensing machine. Go there, pick your scrub, use your batch. Everybody has like 2 scrubs. Even if you have one, you are working and one gets stained, maybe with blood, and you needed to change. Go ahead and drop it back into the machine, receiving machine, then go and get the second scrub, So use your batch, get your scrub, go and change. Once I change, the next thing I'm going straight to the board to see the room that I'm assigned to. Once I see my room, I see my team, who is my surgical tech, who is my CRNA, that's the nurse anesthetist, like we call them in most African countries. Then who is my surgical assistant? Back home where I come from, nurses scrub. But here in America, we have people that we call scrub technicians. They are the ones that, even though some hospitals still use nurses to scrub for cases, but they are just known for that. They are the ones that scrub, So once I know my team, the next thing is to go into my room, start getting things ready. Of course, the people that did night must have set up the room, not really setting it up completely. The things you need for surgery for that day, they will bring it into the room for you. Maybe for your first case, it's in the room. All you need to do is to come in, write on the board the names of those you're working with, the surgeon, or you have to write on the board, because during timeouts, you have to read what is on the board. The surgeon doesn't need to come and start asking you, hey, who is my ST? Oh, no, Stephanie, who is my SA? Once they come in and they look at that board, they already know, oh, Steph, I'm working with you today. Oh, it's going to be a great day. Oh, Tim, I'm working with you today. Oh, it's going to be a great day. And that's it. Write the patient's information, write the date of birth, write the procedure we are doing on the board, write the side. If it's on the right side, if it's on the left side of the body, you have to write it. Is the patient allergic to anything? You have to write it. Is the patient high risk for anything at all that you know the team needs to know of about that patient? Write it on the board, okay? Then this is after I have logged in into my Epic and checked the patient, know the patient, make sure the lab values are okay. Of course, you have to. If there is any lab value that is not okay, you have to alert the team. Maybe the hemoglobin level is very low, or you have to let them know. If it's something they need blood, they need to get a blood into the room before the surgery, they will tell you. If it's something that they need blood to be in the hemobank, we have something we call the hemobank. Instead of going straight to the lab, sending people, oh, go and get blood for me, there's a machine we call hemobank. It has blood. The patient has been cross-matched, grouped, and all that. You put the blood in the hemobank. Once you need it, instead of leaving it in the room, just go straight. It's still within that OR environment, okay? Go straight, scan the patient bracelet that contains the patient's information. It has a barcode. Once you scan it, it shows you everything. Then pull the blood from there. So these are the things, the preliminary things you do to get ready for the day. And when that is all done, you've checked everything is order, start opening your case. And you have to make sure all your team are in the room. You don't want to start a case or close to getting your patient into the room. You find out that, oh, where is my surgical assistant? Those are the things that is going to delay the case. You don't want that. If you are in the room, of course, knife on skin, or patient should be in the room at least 7:30. If that case, if they usually tell you the times, if sometimes, if it's the days that we are doing meetings, like education, we usually start surgeries around 8:30, 8:45 a.m. But if it's a normal day, surgery starts at 7:30 a.m. At least the patient needs to be in the room at 7:30 a.m. Anything outside 7:30, the patient is late in the room. So you don't have a case starting at 7:30 and at maybe 7:15, you are going down to the pre-operative area to get the patient and you don't have your team in the room. You have to let the charge nurse know, hey, I don't have this team member in my room. If they have a replacement, they will send one immediately. Before you go down to get your patient in the OR, very important, make sure your instruments are sterile. If you open your instrument tray and it's stained with water or the paper lining has a hole in it, it is considered contaminated. You have to take it back to the CSSD so that they can give you another tray. Even your pack, as little as opening a lap gauze, or even a gauze like we call it, if you notice that the pack is torn or has a hole, you have to discard it. So all these things has to be in place before you go to get the patient. If it's a surgery that requires implants, you must have that implant in the room. The implant has to be in the room. We don't want to start a case and it's time to open implants. Hey, I don't have this implant. Any second you waste in the OR matters a lot. It's a fast-paced area to work, but it's also very nice. It's also rewarding. So when you get your patient when you go down to the pre-op, you see your patient. Hey, Mr. A, good morning. Of course, you introduce yourself to the patients. Check the consent. Is the consent signed for the surgery? If it's not signed, you cannot take that patient to the operating room. Oh, Americans are very good with suing people. I want you to have it at the back of your mind. Patients knows their rights. Do you understand? It's not like in America, patients are the decision makers when it comes to their own health. It's not like most African countries that their families take decisions for them. Maybe this person wants to go to surgery, it's the family that will decide. No, in America, the patient can decide for himself. So make sure that that consent is signed. Even if by mistake, you take a patient to the room without a consent and it's during timeout and it was discovered that this consent was not signed, you cannot go ahead with that surgery. You have to reverse that patient. Even if the patient is under anesthesia, you cannot. You must reverse that anesthesia and bring that patient out and reschedule that case. It is that they take it that serious. So as a nurse, this is your role. Make sure everything is in order. Make sure the surgeon signed the consent, has signed the consent, and the patient has signed. Make sure that is the procedure that you see when you logged into the computer that is on the consent form. Sometimes the patient will have something on the consent form and it's different from what you saw in the computer. You have to stop and ask questions. Those are the things that can warrant you to be late in the room, because of course you can't be rushing. Oh, my case is starting at 7:30. Let me rush so that, and then you come into the room and there is a problem. At that time, you become a failure. So if there's a discrepancy from what the patient, just last week, patient says, oh, the patient is supposed to do just a hernia surgery. Yes, and the patient was now saying, oh, they told me that I'm also doing an angiography. I'm like, no. Who is gonna do that? This is general surgeon doing hernia surgery. Angio is gonna be done by a vascular surgeon. So what's the relationship? I was confused. I said, no, and the CRNA looked at me. I said, what are we doing? The woman was insisting, the husband was insisting. Yes, that's what they sent to us. We even signed it. I said, okay, hold on. I called the doctor. I said, hey, please, you need to calm down and explain to this patient, because what we are doing is totally different from what she, assumed or seems to know. So the surgeon had to come down and say, oh, no, don't worry about that. That's the surgery for another time. When we are done with this hernia surgery, it's another surgery that you need to, get done. We're not doing all of them today. And patient was like, oh, okay, I didn't understand it that way. These are little details that you must clear before you bring that patient to the OR. Surgical marking site. If the surgery is going to be on the right hand, make sure the surgeon marks it. You don't want to bring a patient into the room and assume, oh, it's on the right, and it happens to be on the left arm. That's a big trouble. I got a recognition one time in one of the hospitals. I just started my first 1 week. I just started working and I went to bring this patient. On getting to the pre-op, the consent says right arm, right leg, right lower extremity. That's how we do it. And then that's what the consent says. And then the surgeon marked the left lower extremity. I was confused. I said, I asked the patient, where are we working on? The patient said, we're working on the right side. I said, okay. I went to call the doctor. Some of them can be arrogant. I want you to know that. He did not believe me. He said, what do you mean? I've been here for years. There's no way I will make that kind of mistake. I said, can you please, even if you don't want to come and see this, send someone to come, send your SA, send your resident, let them come and take a look, because I know what I'm saying. I'm here with the patient. And then, reluctantly, he sent a surgical assistant. On his way, he was saying, I don't know what you saw, but he can't make that mistake. And then when he got to the patient's bedside, indeed, he marked the wrong side. And he went to tell the surgeon, hey, guy, you marked the wrong side, He came back. Instead of him to say, I'm sorry, this, he just said, that's why we are team members. But that's, by the way, that's why we are team members. That means what I don't see, you see it. But when I was telling you what I saw, you never believed it. You never believed we could be team members at that time, So little details like that, you make sure that the site is marked. That's the hallmark of the surgery even. You can't bring in a patient without the sites being marked. We don't want to come into the OR and do surgery on the wrong side. You are going in for a lawsuit. That is it. And then when you come into the OR, I didn't do, so when you come to the pre-op, after seeing your consent, let me take us back a little bit. You go to the patient, you have to ask some questions. Even though you know this patient, but you still want this patient to tell you who he or she is. You check the bracelet, the armband, you read the name, confirm it with what you have on your, we are that thorough. Confirm it with what you have on your consent form. Oh, Mr. A. Okay, I know a lot of people have asked you this same question over and over again, but it's just for safety reasons, okay? Do you mind confirming your name and date of birth for me? And the patient will just laugh because he or she knows 1,001 people have come in here and they have asked me confirm your name and date of birth. We want to do it because we don't want to enter into trouble. We don't want you to come and sue us at the end. And they will tell us, oh, my name is Mr. A, my date of birth is so. Okay, in your own words, can you tell me the surgery we're doing for you today? And the patient will tell you, oh, I'm doing this, I'm doing, then you go ahead. Okay, if he's on the right side, did the surgeon mark it? Was he here to see you today? Oh, yes, he came. What about the anesthesiologist? Oh, have you seen him today? Did he explain everything about the anesthesia, the process and all that? You say, oh, yes. If the patient at any point say, no, I'm not clear with this, you have to stop and go and get the anesthesiologist or the surgeon to come back and explain to them. You're an advocate at that time. Do you understand? So also, okay, how did you eat anything today? Sometimes I don't even ask them, did you eat anything? I will just go straight. What did you have for breakfast today? I was able to catch a patient. You know, if you ask me, oh, did you eat anything? Because I was told not to eat before surgery. It's easy for me to tell you, oh no, I did not eat anything, but I'll just come straight. Hey, tell me, what did you have for breakfast today? And one was honest enough to tell me I just had a bacon and a little sandwich. And I'm like, oh, you did. And he realized what he has done. He even started laughing. I'm like, thank you for letting me know. And that surgery was canceled. You know, and also after that, allergy. We don't want to bring in a patient that has latex allergy in the room and we are using a latex glove. That patient is going to react to it. We don't want to bring in a patient, for instance, that has allergy to sulfur medications, and you come into the room, you're giving that patient a medication that contains sulfur, maybe an antibiotics. We don't want to do that. The patient will start reacting to it. So know the patient's allergy as well. You know if the patient has metals anywhere, especially in the leg where you're going to put a bovie pad. Bovie pad is like we use it to limit bleeding during, is a cautery, we use it to limit bleeding. So you don't want to put a bovie pad on a metal. It can shock the patient. We don't want to do that, okay? So these are all the questions you ask this patient. Ask the patient who is going to be with you after the surgery. Is there a family member in the waiting room that we can reach if there is any emergency that we need to talk to someone? Maybe this is the consent you signed and there is a clause that we might be doing this, and we enter inside and, oh, we need to do this, and we have to have a family member to notify, oh, okay, now we want to go ahead and do this. We want to know who we can call. There should be a number that the patient can tell you, yes, you can go ahead and call so person, you know. And when you're done, of course, yeah, they're saying bye, not bye forever to their loved ones. Do you want to give your wife, your child a hug or a high five or a kiss? And then you take the patient to the OR. It's so calming. It's so reassuring, you know. And also they receive their relaxing medication for them to be calm. Some of them are usually not even some, most of them are very anxious. They are scared. They don't know what they are going into face. So you give them that relaxing medication, maybe Valium, give it through the IV, and they are relaxed. Then you bring them into the room. Yes, Mr. D, please.
Yeah, I just want to make sure that everybody is following us because everywhere is so quiet. So I want to make sure that everybody is following. So please kindly go to the comment section. If you're still following, kindly type following on the comment section so that we know that we still have everybody in the room. It looks so quiet. You've been the one talking, and I want to make sure that everybody is getting value for their time today. So kindly go to the comment section and type following for me. Thank you so much for all the people that have, and I also wanted to give you a chance to get a small breath so that you can continue. So thank God everybody is following us. You can go ahead, ma. Go ahead.
Thank you very much. Okay, so now we are done in the pre-op. Pre-op is where they prepare the patient, right? The next thing is to bring the patient from the preoperative room, from the preoperative area to the intra-op area. Intra-op in perioperative means preoperative, intra-op, and post-op. That is just it. So pre-op is where you prepare the patient, all the labs, everything, make sure is in order. Intra-op is where the surgery is taking place. So once you come into the room, you have to reconfirm again, who is this patient? Hey, Mr. A, can you please one more time tell us your name? Each time you ask them that question, they will just start laughing. In fact, when you come to pre-op sometimes to ask them, hey, I know you've been asked this question many times, but I have few more questions. One, just yesterday, one just said, I already know. My name is this, my date of birth is this. I did not eat anything. If that's what you want to know, I didn't eat anything. I just started laughing. So it can be that funny. So when they come into the room, you know, like it's story. Okay, when they come into the room, you ask the same question before they start giving anesthesia to these patients. Confirm the surgery one more time, because at this time the patient is going to go to sleep, you know, and you also have a role in the room. Your role, safely transfer this patient from the stretcher that you brought this patient from the pre-op from, transfer to the operating table, sorry. Okay, so that's another rule. And don't make sure that this patient doesn't fall. You know, make sure you have somebody that is guarding the bed while you are safely transferring this patient from the stretcher to the OR table. And when the patient is in the OR table, put, what do we call it again? That we use to strap them, a safety strap. We call it safety strap. Safety strap is just to strap the patient from falling off the bed. You know, patients in America, they take restraint very serious. Restraint is like tying a patient. Once you bring out that safety strap, and once you bring out the arm one to strap their arm to make sure that during anesthesia, as they are moving, their arm doesn't fall off the arm tables, you know, at that point, they're seeing it that you are trying to restrain them, and it's a big crime here in America. So you have, at that point, don't even wait for patients to ask you, are you restraining me or anything? One was about asking me. I immediately said, hey, Mr. A, I'm not trying to restrain you for any reason. If you think that's what I'm doing, your safety is very important to me. During anesthesia, you might be struggling and all that. We don't want you to, you know, have fracture because you are struggling to move your arm. This is the reason why I'm using this to safeguard you. And the patient will be like, oh, okay, I was about asking, or I was wondering if you were trying to restrain me. I'm like, no. Another role, key role, is to make sure that you assist the anesthesiologist, the CRNA. You have to assist them to induce the patient to sleep. Yes, because you'll be by your patient's bedside as they are going to sleep, still reassuring them until they receive that propofol that will make them to just sleep. Then when they sleep, that is at that point you start the main positioning. Remove the dresses, the gown that they are wearing. Then if there are positioners you need to add into this thing to support the position of the patient, that is the time you bring it in. And also you start prepping, clean with solutions. Of course, you've asked this patient, oh, do you have allergy? And if it's the procedure that requires that this patient is allergic to maybe chlorhexidine, you already know that ChloraPrep is something we use in prep in here. It contains chlorhexidine. You cannot use it at that point. You have to look for an alternative, maybe povidone iodine. You use it to prep the patient. And when you are done prepping, at that point, you stay back for the surgical team to the surgeon, the residents, the scrub tech, the SAs. This is the time they come in to prep the patient, like draping, so that the surgery will start. If it's a surgery that warrants or needs a Foley, before prepping the patient, that is when immediately the patient goes to sleep, that is when you put the Foley. You as the nurse can do it, the SA can do it, the residents can do it, the surgical assistant, the surgical technologist, right? They cannot put Foleys for patients. It's only the surgical assistant, the resident doctors, the main surgeon, the OR nurse. You can now put the Foley, but always ask before you put a Foley in, okay? So now you go back, the surgery has started. Okay, when you're done draping the patient, even before we do knife on skin, we still have to do a timeout. Everybody wants to make sure we have the correct patients and we're doing the correct procedure again. You do a timeout and then the surgeon starts the surgery. At this point, you go back and start documenting everything that you have done, right? From pre-op, when you came into the room, all the things you did for the patient, positioning, and all that. This is when you start documenting. Even as you are documenting, your ears has to be wide open. As you are documenting, your team could need anything. Hey, I need this. And because maybe you're not paying attention, they have to scream it. You don't want anybody to scream in the room for you. Hey, can you get this? No, you don't even want them to say it the second time. Your ear should be open to receive information. So if they need anything, leave everything you're doing. Go ahead and get it for them. Come back open under sterile conditions, and surgery continues. At the end of the surgery, the surgeon must do a stop out. Confirm the surgery that you have done. Was there any specimen from this surgery that you have done? Okay, let's go over the specimen. I've done a surgery that I had more than 20 specimens, like 15 up to 10 frozen sections. We were going and going and going, sending and sending and sending. So if I'm doing that kind of surgery and I know that there are so many specimens that are going to be involved, trust me, if you come into my room at that point to give me a break, maybe it's time for lunch, I will not leave my room. This is me personally. I want to make sure that I take care of all my specimens. The specimen, you can lose your job if you miss any patient specimen here in America. You can lose your job. You can be sued for that. Patient can sue you, but because what it means is, oh, that patient has to come back again for them to get that same specimen. You can't subject a patient to that kind of what word will I use? That pain, because it's pain coming back again. So I don't want to leave my specimen under the care of anybody. I take them out by myself. So even if it means eating after my case, I can wait. I'm that particular. Okay, so the doctor confirms that, oh, there is specimen. Okay, go over all your specimen. If there is anyone that was mislabeled, at that time, we have to correct it. But it's very important that when specimens are coming out, be recording. Oh, even if the surgical tech that will pass the specimen to you, because the surgeon brings it out and gives it to the surgical tech, who we call nurses, scrub nurses. In my country, we call them scrub nurses. These are also registered nurses in Nigeria, for instance. But here we call them scrub tech because they are not registered nurses. Some of them are nurses. Okay, some of them are not. Even if they are the ones that will tell me the name of that specimen, I will still go back to the doctor. Hey, Dr. A, I have this specimen. Do you mind confirming the name of the specimen for me again? And he will tell you. You write it on a paper, go to the computer, put it in the computer, print out a label, put it on the cup, the specimen cup, come straight to the scrub tech. Can you give me the specimen? You read out that specimen again. Show her the specimen, not just reading. Let her see the labeling. Then she will pass that specimen. There is no way you will do this and you will have a mislabeling of specimen. But when it becomes a problem is when you have so many specimens at the same time and you are not guarded, you will mislabel the specimen. When you send it to the lab, they won't get the right results. So this is basically how the operating room runs. Then when the patient when they are done with the surgery, they wake the patient up. You know, you scan the patient. I didn't mention count, but we all know that you have to count. Counting is very important. You count before you start procedure, you count. Once they start closing, you count at the end of the surgery. If there is any missing count, you must stop the surgeon. They will search the room. They will bring an X-ray machine into the room. If after searching, we scan, there's something we call a wanding machine is in the room, just a little box, you know, cover the scanner with a sterile bag, scan it around the patient. If it beeps, that means there is a retained swab in the patient's belly. If there is, you have to open up and bring it out. Okay, if after wanding and we didn't also find that missing item, we have to invite the radiography team. Let them bring in their X-ray machine into the room and do an X-ray right inside the OR. And when they do, they will tell us if there is anything that they saw. If they see something that the scan didn't see, we go ahead and open up. And one good thing about America, they will still tell the patient, so you don't hide anything. You don't hide any information because you finish closing. and then you found out that, oh, an item was missing, you go back and open up. They usually tell the patient, they need to know what happened during the surgery. Do you understand? You don't hide anything from your patient. So that's it. Then prepare your patient, dress the patient up, take the patient to the PACU. We call it PACU, post-anesthesia recovery units. We call it recovery room as well. Take the patient, give the reports to the nurse in the recovery room, tell the nurse everything we did. If there is a family member that is waiting for this patient, when they recover, oh, they want to see their family, this is the person to call. Call the person and they will come see the patient. If this patient is not going to PACU and this patient is going to ICU, for instance, which happens almost every time, before you leave the room, once they start closing, call the ICU team. Hey, I have this patient, we are closing now. Are you ready to get a report from me? Give the nurse report. For patient going to recovery room, you can give reports at the bedside. But if this patient is going to ICU, we give reports in the room. In case if this patient needs to be on a ventilator, they prepare, they get respiratory specialists to come and set up their ventilator and wait for the patient arrival, into the ICU. So this is basically what we do. And when you have transferred the patient, you come back to your room, you start cleaning up your room. All right, clean up and start setting up for another case. You're not the one to clean the floor. We have people that do that. And okay, clean up the room, I mean, is finish up your documentation. Those cleaning the room are cleaning the room. They're setting up your bed. Sometimes I do that because I don't want to be late. I don't want to delay my surgeon. Most surgeons, when they are late on their surgery, maybe the first case was scheduled for 7:30 a.m. The next case is scheduled for maybe 10:30 a.m. And now we have gone past 10:30 a.m. because we are waiting for cleaner. The truth is sometimes I get the damn bucket and I start cleaning because I want to have a good day. If your surgeon is okay and they have a good day, everybody is going to be fine in that room. When your surgeon becomes tense, you don't want to get to that point. So I try my best. I know people will say, oh, why would I clean that? I do that sometimes. Not that I do it every time. Do you I do it just to make sure that I'm not late in bringing my patient outside, making your surgeon angry because you are late in the room. What about this patient that has been starving since maybe midnight and have not eaten anything? Do you understand? You also consider this patient. Try and be fast. Bring the patient up, let them do this surgery, recover, and go eat something. So these are little things you do, and your team will be happy. And at the end of the day, oh, thanks for a great day. Oh, thank you. It was a great day. Everybody will be so happy in the room. And, that's just basically the activity in the OR. Thank you. I hope I answered your question,
Wow.
Mr.
Wow. I feel like clapping for you. You deserve a standing ovation for all this, man. Thank you so much. You really went so deep into it just the same way I wanted, because I've been hoping to host an operating room nurse who will give us a very insight to how a day-to-day activity happens in the OR, and you did justice to that. And whether you are in the ER, in the OR, whether you are in the med-surg unit, anywhere you find yourself in the United States, there's one key thing that is going to help you from what she said: paying attention to details. If you always pay attention to details, you will never go wrong. One of the award that she's gotten many numerous awards, but one of the awards that she got that really, really touched me was the one that the surgeon was already about to put in a Foley catheter on a patient that is allergic to latex. That catheter was made of latex. And she was in the room and she was able to catch it. And guess what? This is the way you announce yourself in this country. You cannot announce yourself by speaking English. Come on, you can't even speak more than them. So the only way you can announce yourself when you come over here is by paying attention to details. You understand? That's the only way. You can stop the line and say, hey, I feel like this is not right. Let us check this thing that we're trying to do. And when they check it and find out that you're actually right, even if you don't speak like they speak, they will still respect you. They will still respect you anywhere, anytime they see you. They know you're a valuable asset, because They know you are contributing. Know how much the hospital would have lost if they had operated on the wrong leg for the one that she described. And then if they had put in that Foley and the patient ended up suing the hospital, they would lose a lot of money. So by the time you do this more often and and people begin to know you as one of the nurses in the hospital that pay attention to details, you are going to be in the good book of both the leadership of the hospital. You're going to be in the good book of your teammates. Everybody want to work with you. Even the doctors in the hospital, they want to work
absolutely.
with you. Even in the med-surg department, even in the med-surg department, some of the doctors that I worked with before, when they are operating on a very complicated case, they begin to stay in the OR and call the unit in the floor, say, is Tammy working today? Oh, she's not working. Oh, what about Helen? Is Helen on duty? Because they want to make sure that the person that is going to receive that patient once they are done from surgery is a capable hand, someone that pays attention to details. But let's bring it home a little bit. Someone was asking in the comment section, one of the aim of this meeting today was to help people on how to adapt both culturally and clinically. So somebody was asking in the comment section for us to kind of piggyback on that area and just know how we came. How did you, when you came over to the United States, what were the resources, what were the support systems that helped you? I know you're not just a good nurse, but you're also a mother, you're also a career lady, you're also pursuing a lot of things. You've been in different spheres of leadership in different companies, but how could you do all these things? What is helping you? What is the thing that helped you, especially when you arrived the United States, to be able to adapt? And then currently, what are the things that are helping you to adapt in the United States?
Okay, thank you very much for that question, Mr. Decency. The truth is, to adapt in America is not easy. Compared to where you're coming from in Africa, where you have a lot of people surrounding you. For instance, when you give birth, let me use that as an example. When you give birth, for example, you have 1,001 family members, friends, relations coming around. And here in America, it is not like that. Let me go to my work first before I bring it home to family. So I adapted very well at work because I had a very strong support system. First of all, the hospital that I worked when I came to America was the same hospital that my husband was posted to work by Avant. So he was there before me, and that's the same hospital, and he is an OR nurse. And that's the same operating room that I was going to. In fact, when I submitted, he told them my wife applied. They were all happy to have me because they were proud of what he was doing. So they believed strongly that if he could do this, the wife is also able to, because he's a perfectionist. That's one thing about Mr. D. I diverted a little bit. Okay. He was my great support. In fact, he will come back home and tell me, hey, babe, see, this is this machine. We have not used this in Nigeria. Google it. From Googling, I will show you how they use it so that when you see it live, you are able to, use it. It helped me. He will list equipment and I'm online, Google, searching how to use this robotic surgery. How do they operate this? Which button do you press? Bovie machine, we use it in my country anyway, but theirs looked a little bit different. He will just tell you the differences. These are little things that help. So when I came in fact, one of the nurses wanted to do something funny, but I was smart enough to dodge that. So precepting, during my precepting time, my preceptor, so she was like, oh, do you guys use this where you come from? I have not used it. But I'm like, I think I know. I didn't say yes. I didn't say no. Let it not be that I lie. But I said, I think I can use it. I think I'm able to use it. Because why? When you are doing orientation, or when they are doing orientation for you, you don't just sit back and be saying, oh, they're doing orientation. I'm a very detailed person. I am very, when I'm doing something, I'm very detailed about it, unless I don't want to do that thing. So when I see her do things, I'm just looking. And the first case we did that time, actually, I saw how she used the machine. And then it didn't occur to her that she needed to show me how to use it. Then on second case, she now asked me, oh, have you used this machine before? I'm like, I think I can figure it out. I think I can fix it if you let me. And I did it. My orientation was supposed to be 6 months. My dear, within 2 months, I was off orientation. They were all telling the nurse manager, the director, there's no need keeping her for 6 months. 2 months, it wasn't even up to 2 months, I was off orientation. I didn't have one preceptor like he did. Mr. D had one preceptor that was with him all through until he was done with his orientation, but I have different preceptors. You have the good ones that are able to teach you. You have the ones that will just, oh, I'm just precepting for precepting's sake. No, but I had a great support from my husband and also few preceptors that I had. Okay, those are the things that helped me to adapt very fast. Also, I never go wrong in asking questions. I want you to know when you are in your orientation period, please ask questions. No question is wrong. Don't think you will look stupid asking that question. It's better you ask it that time than they throw you out there to take care of the patients on the floor. Maybe you're in the med-surg floor and you are now alone with these patients and you're not able to. Or maybe you're in the OR like myself and they throw you in, oh, you are now alone manning your room. Okay, go and do this. And you are not able to. No. You have to take charge at that point. Do you understand? So as far as support system is concerned, also, we have a group. That's a very resourceful group. I have to let you all know. We have, the way we have exclusive pre-arrival group, we have an exclusive arrival group. We call it EAG. That group is everything you can think of. Once you come into America, there are people that have gone through whatever difficulty you've gone through at work. These are group for Nigerians, I believe. But some African, I don't know if Africans are in that group, but
I think they have.
they have. So the group is going to be a great support. People come in there to vent their anger. Oh, I was so frustrated at work. These are people of like minds. We are all from international, we are all international nurses, so we don't know it. So this person will say, oh, this happened at work. You come and rant in the group. Maybe it has happened to someone else before. That person will say, oh, it happened to me. This was how I maneuvered. This was how I did it. And then you go back and do it. So that's a very strong support system that we have in that group. Then when it comes to family, I want to urge you all, I want to plead with you. If you are coming in here, you are as an international nurse and you have a family, you are still in your childbearing age, you have a family, mother, sister, anybody you think can come in to support you in any way, my dear, don't waste time. Apply for visa, let the person come in. It's very difficult for you to cope. Don't bank on that your very good friend. Oh, she was my best friend in Nigeria. Oh, we're in the same city. Oh, she's going to be coming to take. Don't bank on that person. Oh, she would disappoint you. He would disappoint you. Everybody is here for a purpose. The person cannot leave his or her job to come and babysit you at home. The person can come in. Hi, how are you guys doing? Highest. Spend 1, 2, 3 hours. But telling the person to come and stay with you, babysit you, do a mugo for you, like we call it, my dear, it is not practicable. So what you can do is immediately start looking for how to bring people in. I didn't have I love babies. If you know me, you know I love babies. I love babies.
Trouble, guys.
I love babies. So I had my 3 boys back home in Nigeria. Then I had a lot of support. When I came into America, oh, it became something else. In fact, my first week in America, I didn't know when I screamed, Grace, can you come and hold these children for me? And my sister-in-law looked at me and she clapped and said, welcome to America. There is no Grace here. Grace was my nanny back home. I needed a break, you know. At that point, you say, welcome to America, where you don't have that nanny here. And it made me, I didn't think about giving birth to a baby. And I didn't have the information I have now. I would have done papers for my family members to come immediately so that I can get done with this. But finally, I decided to have a baby. I filed for my sister. She came. God bless her soul, even though we lost her to the cold hands of death. But she was here with me for like 5 months, helped me take care of my baby before she went back home, you know. So please, the support system we're talking about, make sure you bring in your family member to support you in taking care of your babies or your children. You cannot leave your child at home. If a child is, some states will say 13 years. If a child is 13 years, below 13 years, you cannot leave that child at home. You cannot. If anything happens, the police will come and take that child. If anything happens, if a neighbor finds out that, hey, this child is alone, there is no adult with that child, they're going to call police. Social workers are going to come take that baby from you. You won't, in fact, the baby is going to foster parents because you're not capable of taking care of that child. So don't make that mistake of leaving, oh, my child is 7. Oh, he's smart enough to stay at home. I'll keep him busy with iPad. Children are children. Something might want to take that child out. He might hear a noise outside. Oh, let me run and see what's happening. And from running to see, another thing distracts him. He will start playing. People passing will be like, how can this child alone be outside? And they will come. The nosy ones will come. Hey, guy, how are you? What's going on? And where are your parents? Oh, my mommy went to work. You have entered into trouble already. You have. So that's where you need that support system. You need people to come and stay with you to take care of your children. You can't say, let me run to work. Oh, night duty, they're already sleeping. Oh, let me go for my nights. By the time they're waking up, no, you cannot do that. You can't leave a child below 13 years unattended in America. Please, I think, I don't know if I did justice to that, but
yes,
that's the
you
support
did. Thank
system.
you. Thank you so much, guys. If you're getting value for this meeting, if you're getting value, please kindly on the comment section, kindly type value on the comment section. I want to see if you're getting value for information that we're supposed to share here. If you're getting value for it, kindly type value on the comment section. Also, as that is going on, I just wanted to share something about, there are some people that could be very nosy, and when you come over here, definitely you're not going to buy a house immediately you come to the United States. You're going to rent an apartment, and in an apartment, your neighbor is just like your next door family member. They know almost everything that is happening in your house. So you can have some very nosy neighbors that will just sit on the porch and be looking. They won't even need to, they just know that your kids just came back to school, you drop them off, and then you're driving off alone. That is enough for them to call the police on you. That is just enough for them to call police and say, hey, my neighbor just left some little kids at home unattended to, because, sometimes they don't have any work. They are retired people. They don't have anything they are doing. They just sit at home morning till night looking for who to call police on. So guys, you have to make sure that you have yourself protected. And I've seen, especially in the UK, I've heard so many stories of people who child protection services have taken their kids away from them. I've heard a lot of very pathetic stories about, having to go and visit your kid in another man's house. And, your kid will be telling you, hi, mommy, I want to go back home. And you can't even help because you can't do anything, because right now the law has removed that power to have to be a parent to that your child and giving it to another person, that power of attorney. You don't have it anymore. So I just want to let you guys know this information that she's sharing is very, very important. If you need any help on how to get your visa for your family members, once you get over here, on that EAG group, you can type it there, but also you can reach out to me and I can guide you on how you can apply for B1, B2 and have your mother, your father, anybody that you have that can come and help you. You have them come over. Once you are here on a green card, you can have them come over and help you. All right. So thank you so much.
Let me add one example of this kind of thing that happened. It might not just be your neighbor. I remember a colleague sharing with me how she went to buy something from Walmart. Walmart is like 2 minutes away from her, and she had a 4-year-old sleeping, And then she had 11-year-old, 9-year-old, they were all at home. She, in her mind, how can I wake up this 4-year-old just to go and get something 2 minutes away from me? I will just be fast, back home very fast. And then, unfortunately for her, what is it called? A delivery guy came to their house. The guy was actually coming to the wrong house. It's not their house that the delivery guy was meant to come to. But when he realized, when he peeped, he saw kids playing in the backyard. They didn't open the door, but he peeped and saw children playing at the backyard. And then he was going to the next neighbor's house who had the order, And then immediately he felt in his mind, oh, these children are left alone. He peeped, no adult. Do you know that this guy called the police? Before that woman came back from just what she presumed to be 2 minutes drive, 2 police cars were already waiting in her house. One happened to be a lady, one happened to be a guy. There were two in the car, and the siren everywhere. She was even scared. What has happened to the kids? So they asked the kids, where are your parents? He said, my mom just stepped out. They said, okay, can you open the door? They refused to open the door. They said, my mom said we should not open the door for strangers. Nothing stopped them from opening that door, but on the process of doing that, the woman came back and met them. She was panicking, and they asked her, you left your children unattended? They are young. And she said, yes, that she has a 4-year-old inside that is sleeping. She didn't know how to wake the child up, and the other 2 were hungry. She doesn't have what to give them to eat. So she rushed to Walmart in order to get something. So that was what happened. And they looked at her and said, next time, please don't leave them, that we could have taken all of them before you came back and leave a note for you. So that's a practical example. It might not just be your neighbor. It might be a delivery guy that wants to deliver something and they knock, or something that sometimes you put a delivery and you say, hand it over to me. Most deliveries, they will keep it in front of your house and leave. But some deliveries, maybe it's food, you don't want them to drop your food on the floor. You can make a note, hand it over to me. And then when they now come, maybe you forgot that, oh, they needed to, you signed hand over to me, and they came and knocked and they didn't see you, they gave it to a child. If it's the nosy ones, the army boss, they will call the police on you. So that's it. Just be careful so you don't enter into trouble in America. America is a land of law. You must follow it. There is no maneuvering. You must follow the law. Thank you.
Thank you so much, everyone. And thank you, Stephanie, for your time today. I feel like going on and on and on and asking you questions, but that would be so selfish of me, right? So I want to give others the opportunity to ask you questions, okay? I know I have not even finished the questions that I have for today. I've not even got half, but I believe that we've, at least tilled the ground a little bit to be able to ask some more questions, culturally, clinically, some things that you need to know, some things that you need to do. But also to add to that, I just want to go ahead. You want to, yeah.
Yeah, I want to point out something about culturally, where I come from, it's easy for you to touch a patient. Oh, patient is having, is in pain. You touch the patient, you are talking to patient. It's easy for you to tap the patient. Oh, be careful about that here. You don't touch people like that. They see it as sexual harassment. So these are cultural differences that you need to take note of. Before you touch somebody, you have to take permission. Oh, do you mind if your patient is in pain? Oh, do you mind if I hold your arm? And the patient will say, oh, yes, before you touch. You can't just come into the ward and start praying, oh, God will heal you. Oh, God. No, you have to seek for permission. Oh, do you believe in God? Are you okay if I pray with you? And if he or she says no, please, you cannot do that. You cannot.
You must repent by force.
You cannot, you cannot do that. Please don't make that mistake of touching your patients or just praying for them without asking for their permission. If no matter the pain they are passing through, please don't. That's another thing. Also, the last thing, but not the least, which I am still struggling with as I'm talking to you now, is addressing people by their first name. You will see an elderly woman, 50 years, 60 years, and you say, when I started work, it was an issue. So anybody I say, I'll be like, I'm so sorry. This is where I come from. If I address an elderly person by their first name, it's regarded as an insult. So do you mind if I add Miss or Sir for you when I'm addressing you? Or maybe this person is Decency, for instance. Hey, Mr. Decency. Instead of just saying, hey, Decency, they do it a lot. It's nothing. Even my CEO, I've seen even a girl that is cleaning, saw the CEO person and said, hey, Freddie. I turned, I'm like, is that the CEO she was referring to as, hey, Freddie? But this is how America is. Then we are seeing it as insult. These are changes, these are cultural differences that we have.
Yeah.
So even till now, if I'm talking to people, I still say, hey, Miss Candy, hey, Miss this. I don't feel comfortable calling them by their first name, but I will explain to them, this is the reason why I'm doing this. I see it as an insult. I can't do it. Do you understand? But some of them that will tell you, some will tell you, oh, when you add Miss, I feel like I'm very old. Just go ahead and call me my first name. Those ones, I will call you by your first name. Do you understand? So these are some of the things. Another thing is, I talk softly in the OR when I'm talking to people, but then they want you to shout. And I will tell them, shouting, when I shout, I feel like I'm being rude. They don't see it as being rude. These are cultural differences. They want you to speak out loud, shout, so that people will hear you. Like the way I'm talking now, somebody will tell you, I can't even hear you. Speak loud. Then somebody will have to illustrate for me, say, this is how you talk. I'm like, that's too loud. He said, yes, but you have to do it. These are cultural adaptation, things you have to really adapt to when you come over here. Sorry about that. Thank you, Mr. Decency.
Oh, thank you so much. Those were very, very, very needed. It was, I think it really was a timely addition. Thank you so much for that. And then I want to ask everyone that is on this call a question. I just want to ask you guys a question because there's something that you're going to see in this country that I know that most of the African countries and other developing countries, they don't have it. And that is, you are going to be seeing same-sex marriages, a lot. You're going to see so many of that, okay? So you're going to even see people, I would call them children, who are transitioning from one sex to another, coming for surgery, coming to get a treatment or being admitted in your unit, and they were previously male, but now they are female, something like that. They're now going through that transition. I want you to tell me, honestly speaking, and I don't want anybody to lie, honestly speaking, how would you feel the first time you see a same-sex patient in your unit? How would you feel? Honestly, I want honest answer so that I know if I'm wrong. I want to check myself. So tell me, I will share with you how me myself felt, but tell me on the comment section, how will you feel the first time?
I will preach.
Somebody said you will preach. How will you feel? Okay, just let me know on the comment section. Please, I want this, okay?
Please don't preach, please don't be judgmental. Don't preach. Don't be sad. They don't want to see that sad face on on you. No.
Especially the facial expression. Tell me what will happen to your face, when you get into a room and you see it is two same sex in that room and both of them are husband and wife. How would you feel? Okay, so for the purpose of whatever that we're writing, I'm not going to read it out, but just put it on the comment section. Put it there. I'm not going to read it out. But this is how I felt exactly the first day that I was sent to, do a case here in the US. And that case was a guy that decided to be a guy again it's a lady that wanted to now be a guy. So they were cutting off the breast and, just cutting off the breast. She doesn't want to have breast anymore. Why have breast when you're a guy? So, already you will see some of the physical features of, the drugs that they are on, like the girl is already growing facial hairs and all that. And, they have come to like seal everything. And I was sent to that room to become the operating room nurse for that day. Come on, man. That day, when I went home, I felt like I have committed the worst sin in the whole world. I felt like I could have stood for my faith and just say no and lose my job instead and go home, you know, that kind of thing. So it's some of the things that you're going to see that I'm just trying to prepare your mind, okay? So you are here to provide you know, service. You know, it's just like you consider yourself a one-stop shop for everything. So when people come to you, you should be able to give them what they want. And I know some people will say, what if I say I don't want to be in that room? I want to go and work in another room. Come on, you can't say it every day. What if the only thing that is there to do for that day is those kinds of surgery? You can't do that every day. Okay, so what I said to myself is I didn't make those decisions for them. They decided to make those decisions. And then also, they also have some clinical background. When I read the up notes, I found out that some of them were already complaining of maybe what their breast was doing to them. They're already getting depressed, they're already getting some mental illnesses, and they have to figure out somehow to make a diagnosis out of that before they can clear them to get a surgery. So they have to make out something from it. So that being said, I know a lot of people will be shocked. I know a lot of people, that's one of the cultural shock that you're going to get when you come over here. And I want you to be prepared for it. Go ahead, Steph.
So one thing I want you to know about these differences, that's the essence of paying attention to details that I keep mentioning. So when you come to work in the morning, you don't need to approach patients without knowing that patient. You have to review that patient's documentation so that you don't go there and show that you were really shocked to see whatever you were saying. If you had reviewed the chart, it's on the chart that this patient has transitioned from maybe female to male. All the shock that you're going to show that patient, show it to yourself. In that place, you're reviewing that chart. You can say everything you want to say to yourself. Oh, this patient, oh, why did you do this? Instead of going into the room and you discover that, oh, you were thinking this is a female patient, and then the patient opened his mouth or her mouth to talk, and you discover this deep voice, and you are now scared. Is this a male or female? At that point, the patient already knew that, oh, she's worried about my sex. Don't show patient that. Review your chart. Have it in mind that, oh, this patient is this before you go. Also, there's something else I want to point out. It's different from this. I missed it when I was talking initially. Please, not all orders that the doctors put in that you must follow. Not all orders. Review the order so that you don't land yourself into trouble. I have a typical example of where I worked that the doctor, both of us saw this patient in the clinic. That was when I was a nurse manager, actually. We saw this patient in the clinic, and after seeing this patient, the medication he mentioned that he was going to prescribe for this patient was not the medication he prescribed. And when I was transcribing that order, I saw it. I'm like, no, I can't send this to the pharmacy. I called his attention to it, and he was so happy and said, thank you for letting me know. And he asked me to change the order, rewrite it, and then when he comes back in the morning, he's going to sign on it. And that's it. Just pay attention to details. If you want to save your license in this country, pay attention to details. If not, Board of Nursing will be calling you every time. You'll be going to court every time to answer one query or the other. Pay attention. If you don't know something, ask questions. If they send you to do something and you don't know it, politely ask for clarification, or please, can you give this patient to someone else that knows it? Because I don't feel comfortable. You can say that politely. Please, I don't feel comfortable doing this. I don't feel comfortable taking up this assignment. Do you mind giving it to another nurse? You can do that than taking it, closing your mouth and closing your destiny. By the time you take it, you enter into trouble, and then you'll be answering in the court. Thank you.
Good. Thank you so much. Thank you. And also, I wanted to mention congratulations to all my people that got their interview dates. I'm so happy for you guys. I can't wait to have you guys in Virginia. Remember, Virginia is the best. Virginia is the best. So remember to come to Virginia and say hi, okay? Or whenever you come to Virginia, just give me a call and we'll meet up somewhere and we'll celebrate, okay? So thank you. But for those of you that are planning already on what things that I should carry, what I should not carry, let me tell you, There is African shops in the US, so we have a lot of African shops in the US. You know, a lot of people, when it's time to go to the United States, they will go and almost like they are buying the entire village. Most of those, I'm telling you the
I
truth.
did that too.
A lot of what is it called? Crayfish, you buy a lot of this, you buy all, I don't know, all the things I used to cook. You understand? So there are African stores almost in every big cities. Okay, there are African stores where you can buy something that you can eat. Even if you don't have it in your city, you can drive like 2 hours and then you're able to see an African store where you can buy something. Okay, so, and also some of you go and be sewing, big
Oh my
traditional.
God.
You come here, you might be wearing scrub from Monday to whatever, Monday to Sunday, honestly. For some of you that are here to work, you know, some people actually come here to work and some people come here for a better life. I don't know which one you belong to, okay? But there are some people that came to the United States for a better life. And some people came here to work. So anywhere there is work, they are there. You understand? I'm not part of those group. I actually came here for a better life, so don't judge me. So, but if you're going to be in the class that will be working every time, I tell you one thing, you will not need all those ashebis. You will not need all those traditional clothes and all the clothes that you're trying to pack from. So save those space that you want to put all those traditional wear, save it for another important thing that you want to bring over. You understand? Because once you come here, before you know it, 2 months, 3 months, you're going to the mall, you're going to Macy's, you're going to Burlington, you're going to, Dillard's, and you're going there to buy like the normal American wear. And American wear changes. If it's in winter, you're wearing winter clothes. If it's in summer, you're wearing summer clothes. So they all changes. So you might not be able to fit those your traditional clothes perfectly into this culture. So you might be able to pick just a few traditional clothes just for going to church or something like that. But aside going to church, or if somebody is wedding, that's all. You can, if you want, you can wear it outside. I'm not saying that you can't wear it, but you just get ready to say hi to everybody in your neighborhood. Once you come out from your house, everybody will be like, hey, where are you from? You will spend, if it's a place you're supposed to go in 1 hour, you will spend 3 hours because you're going to use 2 hours to greet people and explain your attire before you get to where you're going to. So Stephanie, go ahead, please. Oh, sorry, you're muted, sorry. And I think we're going to open up the call so that people can actually ask their questions. I feel like we've taken a lot of time today. So go ahead and chip in what you want.
I'll be very fast. I just want to say something. This thing he mentioned now, I'm one of the victims. I packed a lot of food items. Okra, I dried okra. I dried onubu, bitter leaf.
What's not drying? Like we dried for the whole entire
We
US.
dried as if I'm not coming back to my country again. I dried, but the truth is those okra, unfortunately, I threw them away because when I came here, I saw fresh. There's what, like fresher than the one I was eating back home. Yes, there is bitter leaf, fresh bitter leaf, washed and is frozen. You can just thaw it and boil it so that the bitter taste will, go away a little bit and eat it. Okay, the things that I have, all my traditionals, the truth is I'm looking for how to send them back home.
Exactly.
Because now some of, I made a lot of traditionals hoping this, even though we have a Nigerian or African church near me, but it's only on Sundays that I wear those things. So don't spend money sewing all clothes that you're not going to use at the end. Okay, don't spend money. You can get fish. Something like dry fish is expensive here. Something like crayfish is a little bit expensive, but they are all in African store. Do you understand? At least for the few months that you're going to adjust, you can come in with those food items. That's okay. So you don't have to spend so much buying food items and all that. But as you are adapting, the truth is, you will tell yourself, this okra, why am I even using it? Let me throw it away and buy a fresh one. If you feel, okay, let me manage the little I have until I adjust, you can come in with them, no problem. Those that will still be pressing calculator if they are spending $2. How much is this? It's very normal. We all
happens
did it.
To everybody. It happens to everybody.
We
When
all
you
did
go to the mall,
exactly.
you want to
So
buy
you
things
can
in Nigerian price.
Exactly. So don't stress yourself buying. We can talk more after the Zoom meeting so I don't take so much of your time. If you have questions, you can chat me up. I'm willing to answer you anywhere on my WhatsApp, on my Facebook. You can search for me on Facebook. Just send, I'm able to tell you, depending on the state you're going to. Okay, we can talk about that. Let's move ahead. Thank you, Mr. Decency.
Thank you. Thank you. All right. I believe this is a wonderful session, one in a season. If you got value, once again, I would like you to go to the comment section and add value on the comment section. Please kindly add value on the comment section so we know that what we are doing is actually yielding fruits. Thank you so much. Yes, yes, yes. So now we're going to open up for questions. So we're not going to do much of questions on the comment section. If you have any question that you want us to take care of, please kindly use the reaction button and raise up your hand, and I would ask you to unmute your phone, or sorry, your devices, and then you can ask us a question. So kindly unmute yourself, and I know that it's almost time for us to end this meeting, but I will bring Stephanie back again. If you'll be available, I would like to bring you back again so that we can talk about other areas of your life that we have not even touched today. Okay. So like right now I have Alabi Dorcas on the call. Alabi Dorcas, I'm going to ask you to unmute so you can ask your question. Go ahead with your question, Alabi.
Good evening.
Good evening, Alabi. How are you?
Evening in Nigeria, actually. Thank you very much for the lectures. It was very insightful. I got so many experiences. So I want to ask, my those people sponsoring me, they want me to they want to know which time, which areas in US I would like to go to. So I want to ask, where are those places that are reasonable, that are more Nigerians, that you'll be more comfortable and very, at least reasonable to live as a Nigerian traveling from here to US?
So the question is, did they give you options to choose
Yes,
from?
they gave me options to choose like 3 places that I
Okay.
can live.
So one thing I want you to know about deciding where to live in America, every city, every state, they have their own ups and downs. Do you understand? Like
Okay.
you rightly said, if you're looking for Nigerian community where you can be because you are from Nigeria, you can look at places like now in Virginia, we have a lot of Nigerians in Virginia, for instance. Texas is there. You have a lot of Nigerians in Texas, depending on the city you are going to in Texas. Maryland, you have a lot of Nigerians in Maryland, DC axis. You have a lot of Nigerians in New York area. Okay, these are places. I don't know if those places I mentioned, based on what you just said, where you can have Nigerians around you. So these are the few places I know that have lots of Nigerians. There's also a place in Missouri that have Nigerian communities. It depends. It's not just the state. It depends on the city. Okay, because you can be in
Okay.
Missouri where there are Nigerians and there is no Nigerian around you because you are not in the same city with those Nigerians. You can come to Virginia now hoping you will see me, oh, post me to Virginia, or you will see Mr. D, and they post you to maybe which city can I use Charlottesville
Martinsville,
or
Northern Virginia.
Martinsville, and you're happy that you're in Virginia. My dear, you are 3-4 hours away from me.
Oh my God.
Yeah,
We are
that's it.
all in the same Virginia, but you are so far away from me. So we have common cities that we have Nigerians in, like Richmond. We have a lot of Nigerians in Richmond. If you're coming to Virginia, we have them in Chesapeake, a lot of them. I live in Chesapeake. We have a lot of them in Norfolk, Virginia Beach axis. Of course, Virginia Beach is one of the best beaches in Nigeria. You guys should come down to Virginia, in America. I'm sorry to say that. So yeah, it depends on where you're going to anyway, and the city in particular. So like I said, every city have their ups and downs. They have the places that have their crime zones high. They have the places that you wouldn't like to raise your kids. It's there in every city in America, okay? So it depends on what is informing your decision. Thank you. I hope I answered your question.
Yeah,
Very
and
well.
also just to add, if you wouldn't mind, do you mind sharing those cities? Because some of the cities are very, very, very cold. You understand? So if you are someone who doesn't like to be in a very cold region, then that should be also something that you need to consider. But you know, you are so lucky that your agency is giving you an opportunity to choose, you know, but some agencies, they don't. During my own time, is wherever you get a job, you know, that's where you're going. You understand? So getting a job was one of our major determinant of where you go. You understand? So, but yours, you have options. So if you don't mind, if you want to share those places or if you want to share them in secret, maybe later on you can contact me or Steph D and we can talk about that.
Okay. Thank you very much.
You're welcome.
You're welcome. All right. Do we have any other person that has a question? Any other question? All right. Zomi, I've asked you to unmute. You can ask your question now.
Hello.
Yes, we can hear you. How are you doing today?
Hello, can you
Where are
hear
you
me?
calling from?
Yeah, I'm calling from Nigeria.
Okay.
Can you hear me?
Right. Yes, we can hear you. Go ahead.
All right. Good evening from here.
Good evening.
Yeah. Please, I want to ask, I had an interview with one of the direct hire. So they were asking me which experience have I had so far. So I told them that I've had in the last 5 years, I was in medical surgical, and the last 2 years I was in maternity, but currently I'm in ER. So they were like, yeah, how many years of experience do you have? I told them that 2 years of experience now, currently in ER. So I never knew, because this is my first time of having interview with them. So I never knew you can they are, as in, I never knew that they really wanted current experience. Like they really wanted current experience, like 2 years of experience. The previous one you had, they are not counting it. So I myself, I never wanted to work in a place I didn't know. Me coming to work in ER, I don't know how it will favor me. Like, I really wanted to be in medical surgical for the start. You understand? So my question is, can I continue with this direct hire, or can I change them? Or is there any way I can continue? When I get there, I can as well switch.
Can I take that question?
Go ahead, Mr. Decency.
Yeah. All right. So for me, one of the things that you should know is when you're applying for job, before ever you start taking interviews, go back to your CV, tell yourself what you want, tailor your CV towards that goal that you want. You understand?
Exactly.
You have to tailor your CV, tailor it, like make it align very well, and let whatever you have in mind be what you are asking them for. Because you cannot tailor your CV as though your current experience is here and then you're asking for message. You understand? Because the way that they understand something in the US is they believe in experience more than certification. You can have doctorate degrees, they don't care. They want to ask you, how many years experience do you have in message? You understand? Once you tell them you have 2 years experience in message, and they have somebody else that has 5 years experience in message, no matter your qualification, they're going to pick the one that has more experience in message and use the person for the job. Because they believe you're not going to teach, you're coming here to actually do the job. So they need experience for it, and that's what it should be. So for me, I would say going to ER is going to be a long journey for you. ER hospitals in the US, all their ERs are very, very fast paced. You understand? It's not like ERs that I know in Africa, in so many different parts of Africa. No, it's fast paced, except you have worked in ER very well and then your hand is very strong in back home, wherever you're coming from, then you can come over here and, find a way to just maneuver it, but if you're just getting into the ER, you haven't even gotten into the ER very well in your home country, coming here it's just like not knowing how to swim and being thrown into an ocean. That's how you will feel. You will feel so lost in the show. So I feel the first thing you have to do is to contact your direct hire agency and tell them, well, I think you should apply me for this job. I've already amended this is my best strength. Just tell them this is an area of my strength. I'm not so well experienced in the ER, but I am also very, very comfortable working in the massage area. So with that, they are going to be able to help you, maneuver, get that that job that really fits your skill, because the idea is making sure that when you come over here, okay? So I don't know if you understood my question.
I really understood, but the thing is that I even told them that yeah, I can make an adjustment in the because I'm really experienced in massage. But they said, "But you are working in a ER already." I said, "Yes, I'm working in ER, but I've worked previously in massage for past 5 years. I've been in massage." But the thing was, like, I never wanted to talk again. They say, no, it has been documented in the computer, so they cannot do anything about it. I said, okay, no problem, no problem. So me, I'm thinking of changing.
Another thing that you can do, because I wouldn't want anything to delay you, okay? So another thing that you can do is, for me, I think you can go and start building capacity in the ER, okay? Build capacity no matter how, learn all the machines, learn everything that you need to know on the ER, build capacity on the ER. By the time you come over here, you use your resources within the ER, whatever thing that, there's something that they always say when you're orienting: watch one, do one, teach one. So if you watch them do something, don't accept to do anything you don't know how to do. Okay, so you have to tell them, I need to watch someone do it. Okay, so when you watch it, then you do it, then you can teach it. So watch one, do one, and teach one. That's one of the things that they say during orientation. They have to watch, you have to watch them do it first, then you have to do it, then you have to teach other people how to do it. Or even you can teach your preceptor how to do it, because by the time you're teaching, you'll be able to say, somebody will be able to catch whether you got something wrong or you got it right. They'll be able to know how to handle it. So I would say you can. If you try it, you can. I don't want anything to delay you. But anybody that is here, that is listening to me, please kindly go and tailor your CV according to your strength, please. Tailor your CV according to your strength. They are not able to understand how you're working in the ER, and then you're telling them your strength is massage, because they believe that even for you to get a job in the ER is based on your strength. You understand? So your job in the ER is based on your strength, and then you're telling them to put you back. They believe they are doing or making the best decision for you by asking you to be in ER. Okay? In fact,
sorry, another last question.
Said?
Another thing I want to ask is, can I change when I come there? Can I change from ER?
You might, two things is involved. You might lose the job. Okay. And if they are lenient enough, they can push you to a lower dependent, like they can push you to massage. You understand? If you're not coping, they can push you to massage. But there's also possibility that you might lose the job. It depends on your preceptor. If your preceptor says something bad about you, like first 1 month or 2 months about whatever you're doing, and says, oh no, I don't think this person can ever be a nurse, I don't know where the person is coming from, blah, blah, blah. If they write for that kind of review for you, forget it. They'll believe their preceptor that they have been working with for years, more than what the review that just came in yesterday. You understand my point?
But if you not affect my visa, any of my visa or anything, I can get work in another
for
place.
sure. Yeah. You can get work anywhere. That won't affect you. You can get
It's okay. Thank you.
All right. Thank you so much. All right. So we have a lot of hands up. Let's take Alope. Oh, sorry. Steph, go ahead. And after you, Charlotte. Charlotte, you can ask your question after Steph.
Hello. Good evening.
Yeah, Charlotte, give us 1 second. Steph wants to respond to that question.
Okay. Let me mute. So just a general information I want to throw out there. If, just like Mr. D said, the way they perceive specialties is not how we perceive it here. Okay, if you're a nurse anesthetist, for example, in Nigeria, for example, or in any African country, you cannot come to America and work as a nurse anesthetist. No. In fact, for you to enter into their CRNA program, you must have gone through ICU for like a year, 2 years. And outside that, you have to go to school to obtain a degree in that field, like a 3 years program for you to, when you come out good enough, you're coming out with a doctoral degree, because now they're getting doctoral degrees. So don't think because you're a nurse anesthetist in Nigeria or any African country, you will come here and work as a nurse anesthetist. No, it's not structured that way. Again, don't think because you are in maternity or newborn units in your home country, you will come here and work in the same unit here. No, it doesn't work that way. The easy ones to get a job or to just migrate, or once you come in, you are easy to continue from where you were working, is something like med-surg. It's easy for you to continue. It's easy for you to continue as an OR nurse. As an OR nurse, I didn't have to write any certification exam before I joined OR. Okay, even if you don't have OR experience and you enter America and you want to work in the OR, oh, they will welcome you, and they do a course called OR 101, Periop 101. It's a 1-year course. You are working, not like from, for example, where I come from, that you go to school for 1 year to get your OR certification. No, here you can be a fresh nurse from school, and you say, oh, I want to specialize in the OR. They will take you. You are working, they are paying you salary like a normal nurse that is hired. And also you're going through that OR 101. That OR 101 is just like going through specialties. Oh, this month you will work in bonds or what is it called, general surgery. The next month you go to orthopedics. The next month you go to cardiac, thoracic. The next month. So this is how they rotate it. At the end of 1 year, you can write exam, certification exam. So these are some ICU. You can also work as an ICU nurse here, depending on what you answer during your interview, when they interview you. Yeah, I know nurses from back home that came here, they were ICU nurses and they're still working in the ICU. So mind what you're feeling. You can't come here and say you're an IVF nurse back home in your country and you want to work in IVF units here. No, it doesn't work that way. ER, you can easily get a job as an ER nurse, but be ready to really work. It's a fast-paced area, like Mr. D mentioned. So know how to structure your resume, like he said. So you also sell yourself. Also, let me reemphasize on what's happened to you, that you have been, your total year of service of practice maybe is 6 years. Okay, and within that 6 years, you have moved from so many specialties. You've moved from OR to med-surg to ER. The one they're going to capitalize on is the most current place that you are working. They're not going to go back and say, oh, you were OR now 6 years ago. Okay, even here in America, if you're out of OR or out from the OR for like a year or two, before you come back to the OR, it's going to be difficult. They expect you to go back to OR 101 and start again. Or they will do orientation for you, like 6 months orientation, like somebody that has never worked in the OR. Okay, so imagine if they can do it for those here. So compared to you that is coming from international country that doesn't have this thing, their kind of experience. So know what you're updating in your resume. Before you submit that resume, give it to someone to review for you, please. Very important, so that you make sure, discuss where you've worked, so that we will know and see how to help you structure your resume before you submit it. Thank you very much, Mr. D.
All right, thank you so much. And yeah, we have Charlotte. Before we have Charlotte go on with our question, please, I just want to make sure that because we did this when we started, I just want to know the countries that everybody here is joining us from. So please kindly use the comment section and let us know your country, where you're joining us from, please. We did this before, but we are just a few people. I want to be able to know how many countries we have here listening to us. That way, we are more guided whenever we advise to people here on this program. Thank you so much. Charlotte, you can go ahead with your question.
Okay, Mr. D, good evening. Actually, my first question has been answered by Madam Steph. It was about us. They are just beginning my application. Okay, I've not gotten to anywhere yet. They are now about to file my I-140. So I wanted to find out if during the time of waiting, I can do a master's course or maybe a program, a specialized course whilst waiting for the period. And then with that certificate, when I complete it, or when I complete that certificate, is it going to be I don't know, is it going to be applied, or is it going to be recognized in US? Because I heard somewhere, or I overheard that with African, a master's degree or a master's program, when you take it abroad, they don't normally look at it unless you do it in abroad. So that's one. And she has also answered that particular question for me. So the second one is my placement is at Iowa, which the state or the country is Waterloo. So I wanted to find out if you can give me a brief like tour about that place. Though I've read online, do I have some people here who are also going there? How is the experience and how is the weather there? Thank you.
Okay, thank you, Charlo. Where are you calling from? I didn't get that.
It's from Ghana.
Okay, thank you so much for that question. So you said the first one was answered. The second one is about Iowa. Is asking about if we have people in Iowa. Of course, we have a lot of people in Iowa, and we'll be sure to connect you to them once you maybe get here. There's a lot of resources for you, like the group that she talked about. In short, we have groups in different states. Okay, people have come together, formed a group. Even cities are forming group now. So if you come in, ask questions, and they can put you in some of those groups, and you will get a lot of information. A lot of information. Like I've shared it in this group before. There are some things that people are doing privately, but because there is group right now, those people are able to come out and share. And when they share, other people that don't even know it's possible start jumping on it, and they start doing it. I've had people who have been here in the US for a very long time. And I don't know, for some reasons that, they didn't just feel like, getting into real estate and buying houses, you understand? But me and Steph, when we get into this country, within 9 months of being in this country, we're able to initiate our buying a house, first home purchase process. And we bought a house with it before 1 year of being in the US, which many people didn't know it was possible, you understand? And when we did share that we did that, a lot of people started jumping at it. I think somebody has even beat our record. Somebody bought in 6 months or something like that. So a lot of people are now, beginning to do a lot of things because of those closed, knitted group that we have here in the US. So when you come in, kindly get in touch with people that are here, and we'll be able to help you with that. So Steph, do you know much about Iowa? Is there any information you have about Iowa? Go ahead, you're muted. Yeah, go ahead now.
Okay, one thing I know for sure is it's just about asking questions, okay? When you come in, if you have people maybe from your place where you are, there's a group for Ghanaians. That I know for sure. Okay, it might not be group for those in Iowa, no, but as much as you can, try and be in the group for Ghanaians that are in America. They have a group, I know that for sure. Okay, at least that will help you to connect, because it's from this, like the one we have, the EAG, for instance. It's from there that you come and ask question, hey, is there anybody living in Virginia? Oh, I was posted to Virginia. Okay, and you see people that live in Virginia will start coming out. Oh, yes, I live. Where are you in Virginia? And from there, you reconnect with them. Okay, so when you come in, the first thing, or primarily, look for group, WhatsApp group of Ghanaians that are in America. With that, they can now link you up to the city where you are posted. I don't know if I answered your question.
Yeah, I think you did. Thank you so much. Yes, so from what I'm seeing, I don't think Iowa is a bad place. It's a nice place, actually, from the little thing that I've just been able to gather. I think it's a good place, But one thing I want to let you know, there's I don't want to sound so spiritual, but wherever your mind accepts to go here in the US, prayerfully take it. There could be something there that God wants you to tap into. There's a lot of opportunity here in the US. There's a lot of opportunity. So there's no place that is a destination for all. You understand? That, and I hate when people do that. When people say, I must go to Texas because that's where, no. For me, Texas is even so populated and over. I want to be in a place where I should be able to look inward and ask myself, how can I make use of this growing community to be able to better my life? I want to write my name in the petals of gold in that city. What do you want to do in Houston that somebody has not done before? What do you want to do in Dallas that somebody has not done before? But if you go to a smaller, fast-growing community, you can be able to start up some of those things that they are doing in those bigger cities. And 10, 20 years to come, guess what? You'll be among those chilling in the beach, enjoying the proceeds of your investment because you're able to, instead of going to, because once you get into those environments where it is just people going to clock in and clock out, you will join them and you would think everything is about clocking out. No, there are still people who make a lot of money by tapping into different spheres of investment around them here in the US, other than just going to clock in and clock out every day. You understand? So I won't go deep into it because we would do that topic another time where I would tell people different investment and different opportunities that you should be looking out for when you're choosing a city here in the US. Apart from code, I believe the land is green on every side here in the US. All right, so Chioma, your question, please. Chioma, you can unmute and ask a question.
Hello.
Hi.
Hello, Bazdi. Good evening. Good evening, Steph. It's been a long while. Happy Easter to everyone.
Thank you, dear.
Happy Easter.
Okay, my question is this. This retrogression has really beat me up and down. I've gone as far as obtaining a UK RON, yet getting a job is very, very difficult upon the money I've spent. But my question is, do I need to go on with any master's program? Though I learned that they don't really appreciate United Kingdom mode of schooling. That's number one. Then secondly is concerning my daughter. She's 16 plus, and you know how our school here now, she finished secondary school at 15 plus. So is it ideal to put her in a university to start her nursing program, or what do you think? Because a lot is just in this head. And saying, okay, let me see if I can relocate to UK. Their nursing there is chamfa. Let me use that language. I hope I'm not trying to abuse them. Is somehow chamfa. It's not like the way we do it here. So what's your advice? I'm really in a tight corner now.
I'll let Stephanie first.
Thank you.
She's so excited about your question, so I'll let her go first. I can see the beams of smile in her face. So Stephanie, go ahead.
Please, though, I'm just pleading. Don't pause your life because of American journey. Don't do that. Whatever you have to achieve, go ahead and pursue it. Especially your daughter. I'm saying it because of your daughter. For your own, you can wait, come here and do your master's. It's even easier. I bet you it's easier to do it here, and they will value it more as well, knowing that you are finally going to leave here. But for your daughter, please, my honest advice, which we have advised people and it worked for them, please don't hope you are coming here to put your daughter in nursing school. The student loan is not more. You're gonna be paying for those things back. Imagine getting a student loan for 20-something thousand to do nursing when you can use less than 3-4 million to do it in your country. You can't beat that. So nursing is nursing everywhere. All she has to do or need to do is come up here and write her NCLEX, do credentialing, CGFNS, do verification and all that, just like you are doing. And then she will start practicing and it's gonna be easier. What if your process takes, God forbid, 3-4 years? By that time, she would have finished her nursing program. She would have written her NCLEX even. waiting also to come over here. So don't stop your children's life. Don't say, I'm not going to give birth, I'm leaving. No, give birth to that child. The child didn't do you anything for you to hold him or her back. No, please give birth. You will still come here. If you want to bond more like me that wants more, please, you will. Okay? But just pursue your dreams for your children, for yourself. I'm telling you, you can hold on with your master's degree. That is my own personal advice. Any other person can give you a different advice, but this is coming from me. Okay, because I know some people that want to do verification when they come here. Maybe they now want to do something with their masters, or they want them to verify their master's degree that they got back home. It becomes an issue. In fact, to get hold of your school self is a problem. So these are all delays, challenges, and all that. With all running around, going to school, you and lecturers, and no, it doesn't worth it. Just hold on with your own, but for your children, please don't hold on for them. Please, that's just what I have to say. Thank you.
Yes, guys, she said it's her personal advice, and because she's my personal person, so it's also my personal advice, okay? So guys, let me just chip in something, Choma. So there is this, I've given this advice here on this show, and I've actually given it to people personally, okay? And those people are forever grateful that they listened. There is a couple that I canceled. Both of them are nurses. One came over here, and because when he was doing his process, he got married, brought his wife, but his wife was in 300 level in Nigeria when they first came to the United States. So I talked to them, and she's going to stop everything and come here and do nursing. I say, what are you talking about? Just 2 years and you will graduate, and you're talking this thing. You understand? I said, don't do it. Go back home, hide yourself. You understand? Hide yourself, go back home, do your program, finish your program, and come over here. It was tough, yeah, but they did it. You know, she was coming here once every year. So she came here the first time, went home. The second year she was coming, she was already done. She called me and said, Boss D, I'm done. I said, so quick. You understand? And she said, yes, I'm done with the program. I said, okay, welcome to the US. She's right here in Virginia. She's working here in Virginia. Everything's so smooth, and no student loan. Okay, no student loan.
You can't beat that.
I'm telling you, I've also given this advice to some other people, like their children was trying to come over, and I told them, leave your child at home. Leave your child at home. Let her finish nursing. That one, I think their child was in Parkland or in UNTH or something, doing School of Nursing. I said, just leave that child, come here with her first, and then let her go back home and finish and come back and then work as a registered nurse. They said, no, Nigeria is not safe. But you have been in Nigeria for God knows how long, and it was safe for you until when you now got your visa, when you're about to come out, you say Nigeria is not safe. I want to take everybody and run. No, just allow that person to finish the program and let the person come over here. They will help you. Let me tell you one thing. That one that I advised, the daughter is still doing nursing here in the US. The daughter is still, there's another one again. The daughter is still doing nursing here.
The sets have all graduated in Nigeria.
Their set has actually graduated. Some of their sets is even married to somebody that we know. One of the set members is married to somebody that we know, and they are here in the US, and the lady is working. You understand? So cash in on this advice, okay? Don't pause your life. Don't pause the life of your family members. If they have to do anything back home, let them do it, okay? When they finish, if it's something that will need time for them to finish up that program, come with them. Let it be like a vacation. Come with them to the US and send them back home. Let them go and finish it and then come over with qualification. It's better, okay? So that's what I can say, Chioma. And I believe that answered your question. Thank you so much. And I would let Stella, how are you doing? Good to see your face. It's been a long time.
Hello, boss. Decency. Good evening. How are you?
I'm good. How are you doing?
I'm all right. Hello, Steph.
Stella, how are you?
I'm all right. Nice to meet Mr. and Mrs. Decency online today.
Stella used to be one of our IELTS instructor, right? Used to be with us in IELTS.
Of course. Of course, you are right.
Go ahead.
Sorry, I'm at work. I'm about to start night shift, but
Okay.
I am still free now. I can ask my question. But
Yeah,
this
where are you
Steph,
calling
thank
from,
you very
Stella?
much. Sorry?
UK. Where are you calling
Yes,
from?
England. England.
Right.
Yeah. Thank you very much, Steph, for your for everything you've said. So my question is on the aspect of child care. You made mention that 13-year-old child is the only person that can stay at home. Unfortunately, I'm coming, but not with my partner, and I'm coming with 4 children, 14 years, 12, 11 and 8. So I don't know how to do it. I don't know how to cope. And by God's grace, if the bulletin moves 2 weeks, I'll be covered. I'll be current. So I'm really in a very bad situation. What do I do? Because from the look of things, it's only my 14-year-old that I can leave at home. And I don't know, they put me on permanent night anyway. So I don't know, how do I go about it? Then to add to your question, there's something Shoma Christiana said about UK nursing. What she was trying to say, here in the UK, their nursing is not like Nigeria where we do general nursing. You are sent to many posting, you cover all the aspects of nursing. Here, they do adult nursing. So if you want to write NCLEX here, you have to go and do some bridge courses, like for 6 months, where you do ONG, geriatrics, and the others to cover up. So nursing here is like haphazardly, not like our country where we use US curriculum. So that's what she was trying to say. So back to my question, please. Thank you.
So, but the Choma's question, I didn't know. I think the daughter was in Nigeria, right? She's still in Nigeria. She's still trying to get a job to UK, but she hasn't gotten. But she's in Nigeria from what she said. So she was asking about whether the daughter can start a nursing program in Nigeria.
All right. Thank you.
Choma, if that is not the case, you can let us know. I believe you're still in this call. Yeah, go ahead, Steph. I will let you take that question for Stella.
Okay, Stella, nice to see your face.
Said, sorry to cut you. Yeah, sorry. She said her daughter is it daughter or son?
14.
Your
Son
first child is 14.
14, 12, 11, and 8.
Okay. Yeah. Go ahead, Steph.
Okay, 14-year-old can take care of the siblings. So one thing about childcare is how you raise your kids. Do you understand? How involved, how close do you bring your kids into being involved in things you do at home? Like, even my 7-year-old can help the house now. I make them to start early. Do you understand? My 9-year-old can make breakfast for the siblings. Like, he can fry egg all by himself. Fry egg, toast it, give his brothers, make his own. He can make noodles. He can make cereal.
Sorry to interrupt you, but Steph, in terms of that, they are fine taking care of themselves, but I'm talking about laws. If they are authorized to stay alone.
They can stay at home alone at that age, but please make sure you monitor them with camera at home. Make sure you have a means of communicating with them when you leave them, like a phone. Leave a phone and call, sneak out from work during your break. Hey, how are you guys doing? Yes, you can allow them to stay. Even here, Virginia law, 13-year-old can stay. But please leave a means of communication in case of emergency, in case they maybe mistakenly the gas, starts burning and there is fire outbreak in the house. Who do they call? They have to call you. So always leave them with a phone at that point. That's my honest advice. And camera, you can't go wrong in having camera in your house. Everywhere in my house has camera because I monitor my kids. Even if I'm upstairs, I'm monitoring them, seeing what they're doing downstairs. You can't go wrong with that. Even if you're living in apartments, get a camera. There are cheap cameras you can buy from Best Buy. Mount it in your house where you can see them, the spots, the places they usually like staying, like in their room, maybe in the TV room or media room or wherever, their playground. Leave cameras there. I think they should be fine as long as they are able to take care of themselves, yes. But if they are below 13, please don't leave them. Don't go against the law so you don't enter into trouble. Please.
All
Thank
right. Thank you very
Well
much,
said.
Thank you.
Well said.
You're
Thank you,
welcome.
Stella. Thank you, Steph. And we have our last person. Alabi, I think we answered your question before. You have another question? Or your hand was still raised from the last question? Let's hear from her. And that will be our last question for today. And then we'll get our final word from Steph D. Call it a day. How many
Yes,
hours have you
please.
been there? Come on. It's been like
I have
how many?
another question.
We do have another question. Go ahead. Go ahead with your question.
Thank you, sir. Please, I can hear people saying their spouses, like Step D was saying that spouse is a nurse. But for me, my spouse is not a nurse, is a chartered accountant here in Nigeria. So I want to ask, like, what are the chances for him to work? At least when our plan is to, when we are coming, we'll bring one of us and my sister-in-law with us. So childcare will be settled, but his own chance of working over there, what is the chance of working as an accountant or maybe something meaningful? Thank you,
Yeah.
sir.
Can I take that question? So I've
Okay.
had somebody with similar situation, and I don't know if your husband is board certified like ICANN, and there's another specialty that they like qualification that they get, like a global qualification. Is he ICANN's chartered accountant?
He's just ICANN chartered accountant for now.
Okay.
He's
Okay.
not
Yes.
gotten the ACA yet.
Yes, something like that. Yeah. So she needs to start prepping himself to get in that corridor, because that's the only way that he can get a job here, and stand out when he apply at least. But I've seen people who were able to get a job. In fact, I've seen someone who was working in, I think it was either a bank or something like a financial institution in Ghana, and he was transferred from that his job down to the branch that is here in the US. They were able to transfer him, and he was able to get the same job, and he was doing the same thing he was doing from back home. So I think he will be able to do well. All that you need to, now that you have, started, streamlining your life towards coming to the United States, I want you to also encourage your husband to at least start looking into the questions and how to register for those exams, how to get into it and all that. Before you know, he should be able to, take the exam, pass the exam and apply. But that will not help. I will be honest with you. That doesn't happen. In most cases, it does not happen in the year. It does not happen in the first 6 months, okay? So you have to make an alternative plan of what he's going to be doing before he starts, getting into that job that he dream of. It's going to be a dream job, but it won't come immediately. So before then, he can gain some skills, some IT skills, and he can work from home for different companies, different institutions as a data analyst. He can work as a data analyst. He can work as a what is it called? There are so many other like front desk role, virtual assistant for different companies here in the US. Once he's here in the US, most companies will be able to take him, and he will have more credibility because you cannot defraud from within here, because if you do, it's easy for them to catch you. But if you're outside, like people from different countries, I don't want to mention names of those countries, they're always trying to call to see if they can, link up and get people's information, your social security. And I want to say it here, when you get to the United States, on no account did you release your social security number to anybody over the phone. They will call you, they will say, your placenta is right there in front of your house. If you don't call, you will not get it. Don't mind them. Most of them are just trying to get those pay, and they will steal your information, and that will be very, very detrimental. Whatever they do with it is regarded as you did it, because that is your signature. So don't release it for anybody you don't know here in the US. So I just want to put that there. But once he comes over here, he should be able to like get a job that he can do from here. And if he's someone that is very handy or wants to work in the same hospital that you're working, there could be some care job that he will do a training, in-hospital training. Most of your hospital will even like it because they believe that when they employ your husband, some guy on the job. So they would like to employ him and have him work in the hospital. But the best bet is just have your husband stay at home, work from home, so that if there is school run to be done, he can do the school run. If there's anything that needs to be done with the kids, like soccer practice, going to do piano lesson, any kind of those things, or swimming lessons, you can go and do that while you relax yourself at home. You guys are queens. Okay. So, all right.
Thank you very much, sir.
Let him know that and let him start preparing himself. Okay. All right. So thank you so much, everyone. That was our last question for today. We don't have any more. Is this the same Stella that asked question before? Stella, is this your hand still? Okay, so we finished all the questions. I want to thank Steph D. Thank you so much. It was wonderful having you here. And I'm really, really excited. It's one of our very, very good episodes. We were able to cover a lot. And I believe that people here got value. For the last time, if you got value for this meeting, if you really know that you got value, if you didn't get value, no problem. But if you got value for this meeting, please kindly go to the comment section and type value for me, okay? If you really did get value, okay? So type value for me, and then Steph D, be preparing for your closing remarks, and then Kusimo, I don't know that if you have asked your question, but I would let you ask your question as our last question instead of the person that we have, Dorcas. Okay, Kusimo, I've asked you to unmute. You can ask your question, and then we'll go ahead and close out these remarks. Go ahead.
Thank you so
Kusimo,
much.
your life.
Thank you so much for this opportunity.
All right. Where are you calling from?
Thank you so much. I'm calling from Nigeria here.
Okay. Go ahead with your question.
Lagos, actually. Based in Yaba.
Kusimo, for some reason, we can't hear you clearly.
Okay, my question is this. I'm already an R&D. So, I don't know. I really want someone. So sorry. I think the network is. Let me go outside. Sorry, I'm registered in Drive, and also I'm currently running my program in the RM review and also doing my BNS in Laos.
Kusimo, we're having trouble hearing you. Do you have my number?
So process.
Can you chat me up so I can answer your question one-on-one after this program? We are really having trouble hearing you.
Okay.
Yeah, it's very poor. So just yeah, try and get in touch with me and take care of the question. Next week Friday, we're still going to be here. Okay, if you can come here with a better service, we can answer your question as well. All right, Steph D, over to you. Last closing remark for today. Most of our people, retrogression is on the air. A lot of people are saying it on the comment section that they are so demoralized because of retrogression. So kindly, we need your advice and words of encouragement for all the people that we have on this meeting. Go ahead.
All right, Mr. D, I want to appreciate you for having me today. Thank you, everyone that joined us today. It was nice chatting with you guys. All right, one thing I want you all to know is never, ever give up. Okay, know your why. All right, when you know your why about anything that you're doing, it's gonna fuel that journey for you. I knew my why. Like I stated when I was starting, I knew my why I was coming to America. My why was a better career, better opportunity for my family, better life, grow in my career technologically, see things that I haven't seen. I had my why. Okay, I wanted the best for my kids too. So know your why. Your why is going to fuel your passion. It's going to keep encouraging you. It's going to keep pushing you. There are so many people before you. People like, can I mention names? Like Boss Austin, for instance, I knew when they wrote CGFNS trying to come out and it didn't work. It didn't work. He didn't stop. And then opportunity came out. And then he grabbed it. And he is in America. He has spent 9 years here. There are so many people also that have been in retrogression. In fact, I don't know, you guys read the testimony of Boss Stella Maris.
Yes.
My own wasn't retrogression, it kind of, even though it was part of it. But what is more painful than being ready to come out? This is what they call, I was right at the edge of my breakthrough, but couldn't see it. Do you understand? You've gone for visa interview, and then your spouse had issues with one of his tests, and then because of that, you are going back. It's even more painful compared to you that is in retrogression. Do you understand? And yet she was holding on, trusting God. Don't give up. Even if you have not written NCLEX, my dear, write your NCLEX. Hold it. That is why I love Filipinos. They keep writing NCLEX. In fact, when you talk about retrogression, theirs is usually the worst. They're usually so backward when it comes to retrogression. So, but yet it doesn't stop them. Once they are current, man, all of them are running out. They are like a place where I don't know the right word to use. So don't give up. Keep doing what you're doing. Don't pause your life for any reason. Don't pause the life of your children. Oh, even when you have received your visa and your daughter, your son, they are in school and you want to pull them out. Please, my dear, don't pull them. Don't pull them out. Leave them in school. Bring them here. Let them go back and finish whatever program they're doing. As soon as they're done, don't worry about the youth service. Just let them come over and now enjoy that life. Okay, the hallmark of it is don't give up. Retrogression will come and retrogression will go. And also my advice when you finally come in here, please remain humble. There is nothing that is going to help you grow in your career as being humble and embracing learning. Any opportunity you see, please embrace it, learn it, learn things. Don't feel, oh, I think I know this. You might know it in your head, but when you're asked to do it, you will fumble. Don't remain humble. No one expects you to know it all right away. Like I said, if things are not clear, my dear, ask questions. It's better you ask questions than you don't ask and make a mistake that's going to cost you your license. This is the same license you've worked so hard for. This is the same license you've waited years in Nigeria or your home country because of retrogression, and then you come in here. Out of pride, I don't want to ask so that they don't laugh at me, so that they don't feel I don't know it, and then you make a mistake that is going to cost you that license. You can't practice anywhere in America if you ever lose your license. Just start looking for another job that you will start doing. Don't be afraid to ask questions, please. Believe in your abilities. Your training that you received in your country will also equip you more than you know. It's all about having confidence. When you have confidence in yourself, I can't have confidence in you. Oh, my confidence is over the roof. I have so much confidence, but it doesn't mean being confident doesn't mean you are proud. Being confident there are two different things. Be confident in what you know and do it. Proud is you don't know this, but you are just forming, or you think you know it. Being confident and being proud, they are two different things. Language barrier. You will grow, you will outgrow it. It was an issue when you talk. They say, oh, you have accent. Yes, you will hear that a lot. But by the time you start staying here, it's not gonna be any issues anymore. Okay, instead of sitting down watching African Magic, sit down, watch US movies so that you strain your ear to hear what they say. You don't have to even use captions. Try and listen and grab those things they are saying instead of sitting down. These are things also that will, prepare you. Be ready to unlearn and learn new things. Most of the things you know back home in your country, they might be outdated. You're coming to a totally different world, totally different environment. You're coming to, what do they call it? A country, an advanced country, yeah. You're coming here, so you don't know it more than them. So be ready to unlearn the things you have learned and be open to learn new things. All right, seek mentorship. is very, very, very important. All right, seek mentorship. You cannot, or you don't have to walk this journey alone. You cannot walk it alone. Somebody has been there before you. That's why we have some groups. Go there, ask questions. Everybody, people, before you finish asking self, 1, 2, 3 people will respond to you as the question is dropping, unless they are all at work, but definitely somebody will respond to you. And we are here. I'm here. Boss D is here. So many of our bosses are there who are here in America. Chat them up, ask questions. All right. And above all, remember your why. Like I said, your why is going to fuel your passion. It's going to keep you going. Don't give up. Don't say because of retrogression, oh, I'm not going to do this. Just keep holding on to God. In fact, above all, hold on to God. That should be my above all. Hold on to God. Keep praying. As you are there, the delay might be for you to fix something that needs to be fixed. The delay might be a reason. It might be for a reason. It might be for a good reason. There is something that God is waiting for you to do. Do you understand? So that's why I say don't pause anything you are doing because of American journey. Once again, thank you guys for having me today. It's so much fun being here. It's my pleasure being here with you guys today. Thank you, Boss D, for having me. I appreciate you guys. All right. Thank you. We'll keep praying for you. Retrogression will come. It will also go. All right. Thank you. Thank you. And thank you. And have a good evening, everybody.
Thank you so much, Steph D. I didn't know you were about starting the program. I thought you were just giving your final words. I was like, this is a full-blown message altogether, but it was still, it was needed. It's a word in season, and I want to thank you for that. And I want to thank everybody that was here with us today. Thank you for your active participation on our comment section. I really enjoyed reading all your comments, even though some of them I couldn't read them out, but I really enjoyed all of them. All right, but thank you. Next week, we're going to be here with yet another person that is very, very awesome. I'm just not so decided because I have 2 people in mind I want to bring on. So let's decide. You just wait and watch out for our flyers. And next week, I want us to be more than 100 people on this call. Please, wherever you see our flyer, please kindly share it with people. Kindly share it with people. We want to grow this community, and also we want to grow our YouTube channel. So if you are able to go to YouTube and click and subscribe in our program, so that whenever we have this show and we upload it, you'll be able to watch it even if you didn't attend. But our goal is to have a lot of people attend. And we're going to be bringing a lot of people who have migrated to different countries, Canada, UK, US, Australia. We have the connection. We can bring all of them to this show and have them impact on you in one way or the other. So thank you so much. And we really appreciate you guys being on this show. We look forward to seeing your faces. And Steph D, you are so loaded. We're going to bring you here on the show again. We are definitely bringing you back. Okay. Thank you for honoring our invitation. And from me to you, I say bye and see you guys next week. Bye, everyone.